Okay, we're going to talk about anterior cervical discectomy and fusion. This is one of the most commonly performed spinal operations. We do this to treat radicular nerve pain in the arm, so shooting pain down the arm. We also can do it if there's spinal cord compression. On occasion, we will do it for plain neck pain too. Sometimes people have a combination of these symptoms, and all of those potentially would mean you're a candidate. Generally, if we are at the point of talking about surgery, either you need to have this operation because you're in so much pain or we're worried about your spinal cord. So let's talk for a second about how the operation is performed. This is a model of a neck. The brain and head are up here. The front of the neck is here. We have the bones stacked up on top of one another, and we have the discs, which are the shock absorbers in between. In this model, you can see through here, that's the spinal cord, and these little things are the nerves coming out on the side. What tends to happen is a disc will herniate out and start pressing on a nerve or pressing on the spinal cord. And when that happens, generally we get it out by coming in from the front of the neck. So it's a very traditional approach through the front of the neck. We pull the windpipe and the esophagus off to one side. The carotid artery and the jugular vein go to the other side. We work down past the windpipe until we get to the front of the spine like you see it here. Now we don't see the whole thing, we just see a little part of it where we've exposed. We take a scalpel, cut out the front of the disc, and then very carefully take all the disc out from the front all the way to the back where the nerve and the spinal cord are. At that point, we've taken the pressure off the nerve and the spinal cord, which was the primary objective of the operation, but now we've got this blank space here. We can't leave a void, can't have a vacuum, so we have to put something there to replace the disc. That tends to be a disc replacement, which is usually made out of a special kind of plastic or a special kind of bone, either your own bone or bone from the bone bank. Once we have the disc in place or the disc replacement in place, we need to secure it with something, which tends to be a small plate. This is a little model showing a plate, the bones, the disc replacement, which is the little dark thing in between. There's different kinds of cages or disc replacements we use. Some move, most don't. Most are there to allow the bone to heal through the cage or through the disc replacement from one level to the next. It's one of the most successful operations that we have. Okay, let's talk now about the recovery. So this is generally a one-night stay in the hospital. Most people go home the next day. When you go home, you're able to take care of yourself. You're letting things heal, but you're able to function, getting around to the bathroom, up to the kitchen, going out to get the mail, that type of thing. Anytime you have surgery, there are some risks. Anytime you have surgery, there's risk of infection, chance that the surgery won't work, chance you have to have more surgery in the future, chance you have a heart attack or a stroke or something completely unexpected. With this operation, it's very rare to have any complications. Occasionally the bones won't heal. I guess that's really about it. There is some stretching to one of the nerves that goes to the voice box. That occurs in 2% of people, and usually it's temporary. And almost everybody does have a sore throat, and that almost always is temporary also.